Good afternoon, everyone, and thank you for joining us today for this important discussion about integrating family caregiver perspectives into value-based care. My name is Jason Resendez, and I'm the president and CEO of the National Alliance for Caregiving. NAC is a system change organization fiercely committed to building a future where family caregivers are recognized, valued, and supported. We act on this commitment through pragmatic advocacy, caregiver-centered research, and cross-sector collaboration to drive the culture, system, and policy change that we need to adequately support and value family caregivers. Central to this work is safeguarding the health and wellness of family caregivers. The evolution of healthcare delivery has taught us a crucial lesson. Achieving better outcomes at lower costs isn't just about what happens within hospital walls or during clinical visits. It's about understanding and supporting the complete ecosystem of care. And at the heart of this ecosystem are family caregivers. Today, more than 53 million Americans, that's more than the entire state of California, provide complex, ongoing care to an adult or child with special needs, according to research from NAC and AARP. Our nation's National Strategy to Support Family Caregivers defines a family caregiver as an adult family member or other individual who has a significant relationship and who provides a broad range of assistance to an individual with a chronic or other health condition, disability, or functional limitation. This could look like managing medications, providing transportation to medical visits, preparing meals, managing finances, or like with nearly 60% of family caregivers, assisting with complex medical and nursing tasks such as changing a PICC line. Caregiving comes in many forms. It's the daughter in Detroit juggling a full-time job while caring for her aging father. It's the husband in Houston learning to be a nurse overnight for his wife battling cancer. It's a grandmother in Georgia raising her grandchildren while working two jobs to make ends meet. These family members, friends, and neighbors are the invisible backbone of our healthcare system, providing an estimated $600 billion worth of care annually, according to AARP, more than all of out-of-pocket healthcare spending in the United States. But this care comes at a significant cost to caregivers themselves. Many face severe financial strain, with 28% reporting they've stopped saving money and 23% taking on more debt. The health impacts are equally concerning. Research from the National Alliance for Caregiving, AARP, shows that 23% of family caregivers report their own health as worsened as a result of caregiving, with many experiencing chronic stress, anxiety, and depression. Nearly 60% of family caregivers report at least one chronic condition themselves, yet many delay or forego their own medical care due to the demands of caregiving for a loved one. The mental health toll is particularly stark. Family caregivers report significantly higher levels of depression and anxiety compared to non-caregivers, with many experiencing isolation, burnout, and compassion fatigue. For those juggling caregiving with employment, nearly 60% of all family caregivers, the strain of balancing these responsibilities often leads to reduced work hours, passed over promotions, or leaving the workforce entirely. However, there's growing recognition that supporting family caregivers isn't just the right thing to do, it's essential for achieving the goals of value-based care. We're seeing promising developments across the healthcare landscape. Health systems are increasingly implementing caregiver assessments and support programs. Medicare Advantage plans are expanding supplemental benefits that provide respite care and education. State Medicaid programs are developing innovative models to compensate family caregivers. Medicare introduced new caregiver training service codes to reimburse healthcare providers for training family caregivers as they support family members. At the same time, efforts to systematically identify and integrate family caregiver data and perspectives into value-based care, decision-making, and pricing are all limited and fragmented. Today, we'll explore how healthcare stakeholders can meaningfully incorporate caregiver perspectives into their value-based care strategies. We'll examine successful models, discuss practical implementation challenges, and identify opportunities to better support these essential partners in care. By understanding and addressing caregiver needs, we can create a more sustainable, effective, and truly patient and caregiver-centered healthcare system. The perspectives of family caregivers aren't just valuable, they're vital to achieving the quadruple aim of better outcomes, lower costs, improved patient experience, and enhanced clinician well-being. Most importantly, it will help us create a system where family caregivers are supported as essential champions in care. To help explore this topic, I'm excited to be joined by a fantastic lineup of experts from across the care continuum. Collectively, they represent a diverse cross-section of the healthcare ecosystem and offer a glimpse into the change happening to better assess value from the perspective of patients and family caregivers. You'll hear from them in just a minute. But before we begin, I want to acknowledge our co-host, the National Health Council, who we are proud to partner with on this topic, and more broadly on efforts to ensure rigorous patient and caregiver engagement is a cornerstone of value-based care and efforts like Medicare drug price negotiation. I also want to thank Genentech for their support of NAC and conversations like today's. Now I'll turn it over to our panel lineup for introductions, starting with Ushma Patel, Director of Patient Engagement at the Center for Innovation and Value Research. Over to you, Ushma.
Thank you so much, Jason, and the entire team at the National Alliance for Caregiving for inviting me to be a part of this discussion today. I'm very honored. As Jason mentioned, I'm the Director of Patient Engagement at the Center for Innovation and Value Research, and I've been in this role for about 1 year now, but my background is in public health and health policy, with over 16 years of experience in the nonprofit field, mostly conducting qualitative research focused on developing tools, trainings, and strategies to enhance patient and family engagement in all settings. In my role at the center, I work across our organization to ensure that the patient and caregiver voice is captured in all initiatives and that patients and caregivers are partners in the research process. For those of you who are not familiar with the Center for Innovation and Value Research, formerly known as IVI, we are a nonprofit research organization that focuses on how we can do a better job of making health technology assessment, or HTA, also known as value assessment, more patient-centered. Our mission is to advance the science, practice, and use of patient-centered health technology assessments to support decisions that make healthcare more meaningful and equitable. So as we come to this discussion today, I think we first need to address, what do we mean by value? The center refers to value in terms of value assessment or health technology assessment, which is a process for determining the value of a new healthcare intervention or treatment. So, for example, a new drug or a device or digital health technology. It takes into account many factors, such as how well the intervention works, so improvements on patients' health or quality of life, as well as how much this new treatment costs compared to the standard of care. The second question I think we need to address is thinking about value to whom. So with health technology assessments, traditionally we've thought about it in terms of value to payers or the system perspective. But there has been an ongoing shift where we need to consider the value to patients and caregivers. We have a very fragmented system in the US, and we must include the caregiver perspective to understand the true impact of healthcare products or treatments, especially for conditions that have a greater demand for caregiving. I also come to this webinar with a lens of not only a researcher and a patient engagement professional, but also as a patient advocate and caregiver myself. So just a quick story, when I was pregnant with my first child, I experienced significant complications after delivering my daughter, including preeclampsia, HELLP syndrome, and had a stroke actually 5 days after delivery. My daughter had complications as well, which resulted in open heart surgery and ultimately received a diagnosis of Noonan syndrome, which is a type of rare disease. My husband and both of our parents took on such a huge role of caregiving for all of us. So I think it's so critical to really include that perspective. A lot of us are not managing these conditions alone. And I think caregivers are also taking care of themselves as well. So, two prime examples of this is in maternal health. We have new moms having a lot of complications and health issues on top of caring for children that also may have health conditions. And then many of us are now in what we call the sandwich generation, where we're taking care of young kids and we're also taking care of our aging parents. And as a South Asian woman myself, and our country is becoming more diverse, and we need to address the demographic and the cultural differences when it comes to caregiving. So thank you so much for including me in this discussion, and I'll turn it back to Jason.
Ushma, thank you so much for joining us and for helping to anchor our conversation today in your lived experience, your family's lived experience, and for reminding us that caregiving is our common ground. It comes in so many forms, and it's easy to put data, maybe not so easy, that's the conversation we're having today, but really that data becomes much more powerful when we can pair it with stories and lived experience to really drive the kind of change that we need. And someone who's helping to drive that change is next up, Associate Professor of Department of Clinical Pharmacy at the University of Colorado, Dr. Brett McQueen. Over to you, Brett.
Thank you so much, Jason. And it was a great introduction, Ushma, because a lot of the topics and definitions I don't have to cover now, which is great. It's really a pleasure to be with all of you here today, and just want to, be thinking about those in Los Angeles that are affected by the fires, because that's a pretty serious deal, and we especially see that a lot in Colorado. So just wanted to note that. As Jason mentioned, I'm an associate professor in Colorado, and I've been working in value assessment for the last 15 years or so. And I started doing a lot of quantitative analyses. So what's the budget look like in the future if we were to include this new intervention compared to usual care? What would the value of that intervention provide, not only patients, but also society? And through those exercises, I observed that there were a lot of nuances that seemed to be missing. And so we decided to apply for a grant, myself and my team and collaborators, to address this at least in some way, or test different frameworks to, what I would say, lift those experiences off the page and make them mapped over to value assessment in a way that's really meaningful, that actually influences not only the discussion, but potentially the perception of how we see that value as a society, the value of that therapy as a society. So that's been kind of what I've been working on the last 5 years. We use the term mixed methods, and combines both some of those lived experiences with a priority setting approach. So we're understanding what is directly important, not only from patients, but also from family members, other stakeholders, in a way, again, that we can map it over to value assessment. And we've tested this with a variety of different stakeholders with a lot of success. And some of the insights are not only important for value assessment, they're also important for the clinical trial realm. So we've really found the application is fairly efficient, simple, but for some reason we haven't used a lot of the methods that we have at our disposal. So part of my job is publishing on that, getting that information out there, how useful it is. And as we move forward into the future, we are testing a new way that this will be applied, where we can actually standardize some of the information that we would generate or want to generate from families as well as caregivers. Not to say that we don't want all information, but often when we are doing any kind of research in this area, there need to be priorities. What is the most important thing or things to patients as well as their families? So we're working on adopting that framework directly to inform the caregiver perspective, and then how that caregiver perspective flows into value assessment. So really looking forward to the discussion. And Jason, I'll kick it back over to you.
Great. Thanks so much, Brett, for that overview of some of the exciting work that's being undertaken when it comes to integrating the perspectives of family caregivers into value-based frameworks, and excited to dig a little bit more into that. And next up, I'll turn it over to Deneen Ciccone, Vice President of Policy and Advocacy at NAC member and partner Cancer Support Community. Over to you, Deneen.
Thank you, Jason, and good afternoon, everyone. Or good morning, depending on where you are. Really honored for the invitation to be here and kind of share why caregiver perspectives are so important in health technology assessment and the value conversation overall. So, as Jason mentioned, I'm Vice President of Policy and Advocacy for Cancer Support Community. For those of you who aren't aware, Cancer Support Community is a nonprofit that offers free, no-cost psychosocial, emotional, and patient and financial navigation services to all people impacted by cancer. That's patients, caregivers, and survivors through our 196 locations throughout the United States. And in that vein, we have been able to understand and learn and really get caregiver perspectives as it relates to the oncology space and what's really important for them. What we do know is that there are about 6 million Americans that are what we call cancer caregivers. And so what that means to me is that they are a foundational pillar when it comes to patient-centered care and whole person care, particularly as it relates to an intervention and how it impacts a patient, patient health outcomes. And what do I mean by that? So at CSC, what we call ourselves for short, we have a cancer experience registry, which is a longitudinal online-based survey that allows cancer patients and survivors to complete the survey to provide their perspectives, their insights, what matters to them, and answer questions as it relates to treatment, diagnosis, follow-up care, supportive services. And what we have seen in our cancer experience registry as it relates to caregivers is that overwhelmingly, at least 60, 70, 80, 90% of cancer caregivers are focusing on providing emotional support. As you might imagine, they are integrally involved in treatment options, treatment decisions, discussing those with the patient, the care goals for the patient. They're also involved in medication management, managing side effects, managing symptoms, and they are also pretty likely to attend almost all appointments. And so what that tells us is they are at the forefront of understanding how a treatment might impact a patient, how it may not impact a patient. And so incorporating their experience and their perspectives into the value assessment as it relates to a treatment intervention is paramount, because what they can do, they can share information to the value assessment process related to how a treatment might be impacting an individual or how it might not be, any side effects. They may also observe something that the patient might not be aware of. And so that information is really important, again, to the whole patient, as we believe in patient centricity. And also it's important as it relates to patient outcomes, because what we know is that a healthy caregiver is known to be able to better support and care for a cancer patient, and that can lead also to better patient outcomes. And so one way we look at this, like I said, is we look at exactly how their perspective and experience can inform the treatment pathway and the interventions and the patient health outcome. But there's another avenue as well that we think is also really important, and the data gaps as it relates to addressing the needs of caregivers. I would be remiss if I didn't mention, and Jason kind of alluded to this in the introductory remarks, that caregivers, they focus primarily on the patient, and they can sometimes neglect their own needs. And what we have found in our research through our cancer experience registry is that oftentimes in the community oncology practices, when a patient presents with the caregiver, the patient may be asked by the oncologist, the nurse, or the social worker for what we call any distress symptoms as it relates to like mental health, anxiety, or emotional health. Of those surveyed in a recent report that just came out, about 92% of those oncology practices are asking patients about their distress and their mental health and their well-being, but only 16% are asking caregivers. So what that shows us is that there's a gap right? In identifying and that early identification and resource and support allocation for caregivers who may also be under distress. And so through our tool, like the Cancer Support Source and other ways, we believe that there need to be policy levers that really prioritize and incentivize bringing the caregiver perspective into the conversation. Because like Jason said, caregivers are the ecosystem, and we believe that they're one of the pillars, and that when we have conversations at the policy level, at the national level about patient health, patient experience, patient outcomes, that when we talk about patients, we also automatically talk about caregivers, caregiver experience, caregiver impact, because there's a societal outcome when we talk about cost of care, when we talk about caring for patients. And so thank you so much, Jason, for the opportunity to kind of share and kind of level set how we at CSC are approaching this really important topic.
Excellent. Thank you so much, Deneen, for your perspective, bringing a really critical condition perspective and orientation to this work, and also reminding us about the important role that policy plays in shaping this issue. And we'll dive a little bit more into that later in the conversation. Next up, I'm excited to bring our co-host to the table in this conversation. Senior Vice President of Equity Research and Programs at the National Health Council, Dr. Omar Escontrillas. Over to you, Omar.
Thank you so much, Jason, and thank you also to NAC for inviting NHC and be a strong collaborative partner on this important conversation. As Jensen mentioned, I'm Omar Escontrillas, the Senior Vice President for Equity Research and Programs at the NHC. So I help lead our research and programmatic enterprise at the NHC, and primarily is to ensure that patient engagement is embedded into our research protocols and methodologies. The NHC was created by and for patient organizations more than 100 years ago. So we have a good stake on the ground on this. And the NHC brings a diverse set of organizations, again, to forge consensus and drive patient-centered health policy. For those of you who may not be aware of our work at the NHC, we also help to promote increased access to affordable, high-value, and sustainable healthcare. So we are made up of more than 170 national health-related organizations and businesses, which the NHC's core membership does include the nation's leading patient organizations. And we're thrilled that NAC is a part of our membership. But to bring it to the conversation, I think, for us to increase and improve patient engagement in this value space, the NHC launched a value initiative back in 2016 to what we now called a value classroom. And we'll go a little bit more in detail into some of those resources that we have to offer. And it was primarily created to define a shared vision for patient-centric value assessment, to develop great practices for how to engage with patients and caregivers in the value assessment process. So I truly appreciate Ushma and Brett for bringing in those definitions of what we mean by value assessment. Through these tools, we educate patients and caregivers on how to effectively offer their input on value and develop tangible, feasible actions that both patient groups, value assessors can take to ensure that the voice of the patient and caregivers are very integral part of value assessment. So these resources, for example, includes rubrics which help to determine if activities are truly patient engaged. We do hear that the word of patient engagement, patient centricity, but we do offer these resources and checklists to ensure that what do we really mean by these terminologies, and how can we best assist patient organizations who are looking into building their data repositories and building their capacity on providing educated resources for their patients and their constituencies, but also their families and caregivers. And in tandem also with value assessors, we ensure that the input of patient and caregiver perspectives are well accounted for in these value models. So other tools that we have at the National Council include infographics. Again, I do welcome you to visit our website, which are located specifically on this value classroom that were created to visually contextualize the importance of patient-centeredness and value. For example, I would like to also say that for those of you who need to know more specifically on what we mean by value assessment, we develop a value assessment glossary and terminology with plain language definitions and terms that are used in value assessment. This was created with efforts to generate knowledge among our constituents who may not be aware of that terminology used in these higher level methods as value assessment. For example, we also have a Pearls of Wisdom infographic, which provides feedback on knowledge from patient organizations who have undergone these value reviews with a list set of recommendations. Our patient-centered value model rubric really also helps to evaluate the patient-centeredness of value models and guides these developers in meaningfully incorporating patient engagement and also the perspectives and experiences of their caregivers. We have a consideration guide for patient organizations, which is a companion, a beautiful companion to the rubric and the value framework get ready checklist. This guide, it was designed again to assist patient organizations in providing actionable feedback on specific value assessments. Also, for a technical assistance point of view, we updated our value classroom to ensure that we're up to date on the new terminology, what's new in value assessment, and what can our patient organizations understand and have opportunity to really have an uptake and up-to-date resources. And then lastly, Jason, before we turn it over to a conversation, is that our role is in instituting knowledge through a repertoire of educational assets, which really warrant the same attention as the value classroom to further continue empowering patients, their families, caregivers. And I would also be remiss if I did not mention that the NHC has established a value work group, which a value work group is comprised of just patient organizations who have been instrumental in providing input, review of our tools to ensure that we stay true to the essence of what patient engagement is and its principles. So again, I encourage our participants here and our attendees at this webinar to visit our website, explore those valuable resources, which include webinars, guides, infographics, et cetera, that empowered how to shape patient-centered care. So Jason, with that, I will turn it back to you and look forward to our continued conversation.
Wonderful. Thanks so much for that fantastic overview and all the great work that the National Health Council and its members, which we'll get into. And I see many members on the webinar today. So I think your introduction has done a really great job of framing the importance, the value of engaging family caregivers in value-based conversations and assessments. Incredibly valuable, but why aren't we doing it? What are the challenges that we see with engaging family caregivers and collecting data from family caregivers? What are the ethical considerations that we should consider and some of the practical considerations that we consider as folks try to engage and act out on this value? So I want to start with you, Ushma, from your perspective. What are some of the challenges that you've seen in the work of the Institute?
Sure. Thanks, Jason. I love that we're starting with data. I recently heard at a conference that data tells you the what, but people tell you the why. So it's so critical to use mixed methods. And Brett, I love that you brought that up in the beginning, but it's so important to not only hear from patients, but also from caregivers who are really living and breathing those conditions with their loved ones. But it comes with challenges. So it's hard to quantify the caregiver perspective. And it's also difficult to separate caregiving from usual family responsibilities. Many people don't label or identify themselves as caregivers, and families in different cultures, they approach caregiving differently, right? So in some cultures, it's considered a very normal part of their role and very much expected. Also, researchers need to be aware of the respondent burden when collecting data from caregivers. It's often time and resource intensive. Caregivers are often seen as the proxy for patients. And as you mentioned, caregiving spans a lifetime, right? It's a very large bucket. You could be caring for a 4-year-old or an 84-year-old, and those are two very different things. And so it's hard when caregivers are having to respond on behalf of patients. In terms of ethical considerations, I think caregivers may be uncomfortable or disagree with answering questions about the caregiver burden, right? Caregiving is not always seen as a burden. So I think us as researchers and stakeholders in the healthcare system, we need to be mindful about how we're talking about caregiving, right? And making sure that the language that we use in data collection instruments are sensitive to that. And then finally, I would mention two things that kind of span across research in general, but we need to have a clear plan of how caregiver data is analyzed and used in research so that we make sure that their efforts to provide that valuable information is not wasted. And then we need to close the loop, right? This is a best practice across patient and family engagement. We need to make sure that we are letting patients and caregivers know about how we're using their data and how it has impacted the work going forward.
Yeah, thanks so much. I think you hit on a lot of points. One, related to intentionality, right? How we are intentional in engaging family caregivers. And, I think about some big healthcare stakeholders that we've engaged and ask them, why aren't you doing more to collect caregiver data? And what we've heard is, we've ensured that caregivers can take these surveys on behalf of the patients. Like that's totally missing the point. That's a one dimension. So just prioritizing the inclusion of caregivers, I think, is one aspect in the beginning of intentionality. And then how do you continue to do that with caregivers along the way? Anyone else want to jump in on the challenges that you might have seen in terms of engaging family caregivers?
Well, the one point Ushma said something that I thought was really interesting. It's really important that we're transparent and honest about how we use that data. And I heard a gentleman speaking at a conference related to clinical trial diversity. But talking about data, he also said, but it's also important that you close the loop and let people know how that data was used. That's really important. And so that was just one point that I completely agree with what Ushma said, but just kind of wanted to call that out, that just building that trust and that transparency and, building those relationships and that open communication, but having that feedback loop, I think is really important. And, maybe why they are a challenge, it could be intimidating to caregivers, right? Caregivers are very busy. My dad is a caregiver to my uncle. And, would he have the time or the bandwidth to complete a survey on top of everything else he's doing? So you just have to make it really easy, intuitive, and I think just share why it is so important that we are collecting that information and how it could help their loved one and other people that may also be impacted by that condition now or in the future.
If I may add, Jason, to this, is that I think we bring excellent points, but also in the research arena, we also have to be very purposeful in how we define our patient engagement and how we bring in the caregiver perspective. I think oftentimes when researchers come up with our research agendas and ideas, we do come from that ivory tower perspective of what we want to do in order to advance the science. But in order for it to be meaningful to patients and caregivers, we have to co-create these research agendas in tandem with caregivers and patients. That's ultimately, I think, the way that we're going to move the process forward, not only just by ensuring that the data is translated and given back to the communities where it initiated, but also that they are part of the process from the beginning, not just at the middle or at the end. And that will bring it a meaningful collaborative partnership on how data from caregivers is incorporated into the overall research process.
Absolutely. So I think one of the things that, certainly a challenge is the roles and responsibilities of a family caregiver, right? Sort of being time stretched, focused on providing care. And so as we think about ways of overcoming these challenges, I think about the role of technology. And so, Brad, I wonder if you could touch on, how can technology be leveraged to facilitate data collection from family caregivers just to facilitate the engagement of patient advocacy groups and engaging family caregivers. I think we're seeing the pace of technology shift really rapidly, particularly within the healthcare sector. How can we harness that in support of addressing, this really tricky challenge of helping to capture these insights from family caregivers in a responsible and ethical way?
Yeah, it's a good question. I think I go back to Ushima's point that you could ask any question. If it's framed incorrectly, you're going to get not a great answer, right? So the framing really matters, the words that we use, the way we ask the question, to the point where one of the frameworks that we have tested with patients, we actually ask them, hey, we even worked with a health literacy expert. We want to make sure we're all on the same page. We're talking about this. And do you understand exactly what we're talking about? So technology is incredible. And I think part of it can be helpful to record responses, say on your phone. That technology is already available. But if we don't have the correct design, so if I don't know what your life looked like before your disease or during your disease without the intervention, whatever the research question may be, then the information may not be useful, just as similar as if you didn't frame it correctly and the question correctly. So again, technology is great, but we need to make sure the research doesn't suffer because we have this ease of technology. The final thing I'll say is we ran into an issue with accessibility in using more advanced technology. And we got to the point where we were recording responses and there was a participant that was visually impaired and couldn't use the technology. And it was incorrect. The email that I received from the technology, we knew this was going to be, a factor. And the person that responded on an email said that the technology did include a mapping for, because there's a really great iPhones for the visually impaired have that's really advanced technology. And we thought that was applied with this technology, but it was not. So if you're doing this research, you need to double and triple check that accessibility is available for all participants.
Yeah, absolutely. I think that underscores, we think about all the types and forms of care, and accessibility becomes really critical in how we design data collection, is how we design the survey questions. You name it. I think accessibility needs to be at the heart of this work. I want to remind our listeners and panel attendees, if you have questions, please put them in the Q&A box for the webinar, and we'll queue those up and pose them to our panelists in just a few minutes. Next, I want to turn the conversation over to Deneen. You brought something up earlier about the importance of policy. I think it's going to take all levers to shift the value-based conversation to be more patient and caregiver centered. Certainly how the research community engages in outreach, how payers prioritize this. And so policy becomes a really important dimension in influencing a lot of the issues that we're talking about today. What are your thoughts around specific regulatory or legislative or programmatic efforts needed to advance the integration of caregivers into value-based conversations?
Yeah, so I think, barring like a legislative mandate, there are other things that we can do as part of the community to help ensure that caregiver perspectives are included in the value conversation. One that comes to mind, there is the Inflation Reduction Act that was passed that now allows Medicare for the first time to negotiate drug prices for certain drugs. And as a part of the Medicare drug price negotiation program, they have a vehicle or a mechanism to allow for patient engagement, patient feedback. And, there are iterations that folks believe, that it could be a little bit more responsive. And one way that, cancer support community through the larger patient advocacy community, what we did is that we actually created some patient-centered principles with others in the patient advocacy community as it related to the Medicare drug price negotiation program. And what those patient-centered principles say, Medicare or any other payer or any other entity, when you are going to decide the value of a drug, particularly the clinical value and the clinical benefit, it is really important that you incorporate what matters to the patient and that you also understand and you hear caregiver experiences when you make those determinations as it relates to the clinical value or benefit of that drug and even looking at the alternative. So we as a patient advocacy community, we see a mechanism here to really get the patient and the caregiver in that value-based conversation, which is really important. Another opportunity that I see, it's not in the oncology space, it's in the dementia space, right? So the Center for Medicare and Medicaid Innovation, they have a pilot, a demo, the dementia care model, right? That allows for respite care for caregivers that are providing caregiving resources and services to their loved one that is impacted by dementia. So I think CMS, again, could be creative in the ways and really work with the patient advocacy community on how you can incorporate the caregiver experience, the caregiver perspective in value-based methods and test how the inclusion of caregiver perspectives impact a patient's health outcome and if it in fact brings savings to the healthcare system and if it improves the quality of life for that individual. I also think what we could do is work more closely with technology assessors and payers to really bring the caregiver perspective to the conversation and not as a footnote, but really have it become integral part of when you're looking at determining the clinical benefit or the effectiveness, or the safety of a drug, that the elements as it relates to quality of life, as it relates to treatment outcomes, as it relates to what does success look like for that patient or caregiver, that those data elements are incorporated at the beginning and that they're measured and followed as real world evidence comes in. And lastly, what I would say is, again, from like another policy lever, we do know that Medicare implemented some really important reimbursement codes that I think, again, really goes to that value conversation and really empowering and strengthening and understanding the support that caregivers needs through like the caregiver training services and through the principal illness navigation codes. So that's a long way of saying it's just not one lever. There are multiple levers. We can work with regulatory, we can work with the legislative vehicle, and we can also work with health technology assessors and payers because there's more than one way, right? I believe to really include and expand that conversation as it relates to value and bringing in the caregiver voice. And I think this is a real opportunity right now that we have in the new Congress, new administration, because this is a bipartisan issue. One thing we do know is that regardless of what side of the aisle someone is on, they definitely there's a recognition that caregiver value, caregiver perspective, caregiver experience is important and should be a part of the conversation. And there should be policies that support caregivers as well.
Love it. Thank you so much. Any other thoughts on policy levers that you'd like to see moved in support of better integrating caregiver, whether it's from a data collection perspective and supporting those efforts, or from how those perspectives are actually implemented and integrated? Welcome other thoughts as well. Great. Well, we will move on. Omar, you started to talk a little bit about, it's great to talk about this in terms of, objectives and what we'd like to see, but the rubber meets the road. Like, how do we actually start to do this? So you talked a little bit about some of the tools that National Health Council has developed. Can you delve a little bit more into that and how folks, I love the diversity of perspectives that are represented here, a lot of patient advocacy groups, which to me is really promising because alongside patients are family caregivers helping to support and navigate care. So how do we engage and empower patient advocacy groups with tools to better engage caregivers in these conversations?
Of course, no, thank you, Jason. I think it's important to state that patient advocacy organizations, some may or may not be able to collect data from their members, to review their policy goals, or even within their patient constituency. So additional direct input from patients and family givers is important, and why it should be a strong core of the foundation. And I think this is where the NHC comes in. For example, the NHC, and along with its partners, including the Center for Innovation and Value Research, really undertook the creation of a blueprint for developing what we called patient-centered core impact sets, or PCCIS. And this is primarily to address those inconsistencies that occur between what patients, caregivers report as important to them versus much more of the information that is routinely collected in research and care. And this goes back to some of my statement that I mentioned earlier, is that we come as researchers from what we believe is important to the patients or to caregivers, but that might not be always true. So this PCCIS, or core impact sets, what's a way to help patient organizations and those who are collecting patient data to prioritize first these lists of important data, existing past research, and also to eliminate these biases that oftentimes may occur in the collection of data. So organizing data collection and prioritization, it's a way that ensures impacts that are most important to patients and their caregivers really end up in a final set. And again, I want to make sure that stress that this tool that we have in this method is disease agnostic. So it has multiple impacts downstream, which will include value assessment, clinical outcomes assessment, clinical trials, et cetera. So I think it's important, again, to highlight this wonderful tool. And what do I mean by impacts, right? So impacts really refers to those things that patients and caregivers tell us is important about the way a disease or its treatment affects their daily lives and that of course, the overall family and caregivers. Impacts can include those short and long-term health outcomes and any other related implications. So we could say, like, for example, mental health effects, caregiver and family stresses. What is that economic burden, the work and career loss, et cetera? So it's a multiple, and robust list of impacts that might be more important to a patient than just say, my pain management. There are other things that patients and the caregivers find important. So another disease agnostic method that we have successfully developed at the NHC is our patient experience mapping. So patient experience mapping, and we talked about importance of data, and it's a set of publicly available resources that assists researchers and the greater stakeholder community to engage and document patients and their caregivers' experiences, before a diagnosis, while getting a diagnosis, and then living with a diagnosis. So it's a set of qualitative questions that we are able to ask. For example, what is your family experience with your disease, with your condition? How has that either improved your overall diagnosis, or are there things that we could learn from your patients or from your family and caregivers? So again, the patient experience mapping, it does include project planning, data collection tools. And it is also important to note, Jason, that these patient-facing tools were reviewed externally by health literacy experts and refined through patient cognitive debrief interviews. So again, I encourage those who are present in this webinar to really look at our website and contact us to identify how best we can help in framing a research agenda, or helping you to, again, how do I want to amplify my patient experience into, data that is important for a value model or for an assessment or HTA. We really want to make sure that these tools are available at your disposal, and we're here to assist you in any way possible to amplify these methodologies in real world settings.
Love it. Thanks so much. And we'll make sure that we share with folks in the chat, in a wrap-up email, links to those tools. And I want to give, before I turn to the great Q&A that's bubbling up in the box, I want to turn it over to anyone else, whether that's Ushmar, Deneen, sort of other resources that your organizations have, tools that are out of the box that folks can go and start to utilize. Feel free to highlight those now. And again, we can share those as well with participants afterwards.
Sure. Thanks, Jason. I'm glad you brought that up. And Omar, you mentioned the NHC patient journey mapping tools, which we have actually been using as part of our larger Uncovering the True Cost of Healthcare project at the center, where we are really looking at patient-centered economic impacts. And so that's very much related to value, and it's looking at not just what is the direct medical costs that patients and caregivers face, but also kind of the ripple effects, right? So we mentioned the impact on social health, mental health, emotional health, as well as losing jobs or your career trajectory. So we at the center have developed a framework that describes these impacts, and we're taking it a step further to really put this framework into practice. And so the goal of our project is to empower researchers, funders, and patients to come to the table to talk about these various impacts. And we've done a series of interactive workshops, all virtual, free to the public. We've conducted 2 so far. The first was on patient journey mapping and using that as a tool to uncover those economic impacts. We've looked at time impacts, and then now our next one in late February will actually focus on the caregiver perspective. So it is, free to join. I encourage all of you to follow our center page on LinkedIn and check out our website. We'll be opening up registration very soon for that workshop.
Thank you. And Jason, what I'd like to add, if there's anyone here that's impacted by cancer or knows someone who is impacted by cancer and they would like to participate in our cancer experience registry, which I shared is a online longitudinal study where we collect information about treatment, diagnosis, outcomes, experiences, and supportive care services for those impacted by cancer. More than happy to share that information as well. And if you know someone who is a caregiver, who might benefit from our cancer support source tool, which is a distress screening tool, more than happy to share that resource as well as some follow-up materials. And what I would like to say is, when we collect this information, we're collecting it really to kind of help bring that data to various stakeholders about the experiences of those impacted by cancer. And for example, one way we do that is when the FDA, the Oncologic Drug Assessment Committee, when they get together to review the safety or efficacy of a drug and make a recommendation to the FDA commissioner, through their public meetings, we are able to really provide that patient and caregiver perspective related to a specific condition, as it relates to quality of life, as it relates to side effects, as it relates to needs, wants, and perspectives of patients and caregivers because of that cancer experience registry. It's patient informed, it's patient driven. And so that's how we continue to amplify the voices of cancer patients and caregivers in these conversations.
Wonderful. Thank you so much. And I want to turn it over to questions, but I also want to read, I thought it was a really powerful comment in the chat from Antoinette, who said, I am not always asked as a family caregiver my thoughts or opinions, but for the ones that I did, I built so much more trust and respect. So I think that underscores the value of engaging family who want to and are contributing, and that contribution needs to be recognized, and that could result in greater trust, greater engagement, better outcomes. So building on that, I want to turn it over to the audience. And one of the questions I love, because I think one of the things that we're doing here is we're envisioning a future. What would the future look like if caregivers were more adequately engaged and integrated into the value conversation, into value-based frameworks? So I really love this question about, could each of you succinctly describe what success looks like if the issues we've identified were solved? So what does success look like if we're able to wave a magic wand and these issues were fixed today? And I'll start, it's a little bit of a hot seat question, but so I'm going to start with Brett.
Yeah, it is a really, really good question. And for me, what I would, of course, being more on the science end, like a lot of you, I'd like to see standardized instrument that has been prioritized by different samples of willing participants from caregivers. What's important to you? We actually include that standardized instrument in randomized control trials when we assess a new therapy for regulatory approval. And the reason I bring that up is because once you measure something in a randomized environment, you can generally justify the use of additional resources when there are changes in those outcomes. And that could be, hey, we have an instrument that captures not only the health benefit of the patient, but also of the caregiver, the additional costs that are spent, the additional time that's being spent. Maybe there are changes that benefit the caregivers when there's a new therapy approved. But if we have that in, and it doesn't necessarily have to be in a randomized control trial, it could be any study design where we're assessing the benefit of a therapy, that really allows us to justify using more resources. And like you said, waving a magic wand, a lot of those resources, you get pushback from people that say, well, that's not being assessed as part of the primary endpoints. Well, what if it was included as secondary endpoints? And you could measure the effect not only of the disease at baseline, but also how that intervention is impacting patients, but also their caregivers. And I think that would be really helpful.
Love it. Definitely. Other thoughts on success?
So success for me, succinctly, would look like patient and caregiver perspectives are factored and included at the onset and throughout the value assessment conversation and the payer decision-making process. And like I said, it's not a footnote. And that there are levers that are put in place at the policy level. I would love to see a national healthcare bill of rights that talks about the rights of patients and caregivers with respect to receiving healthcare services, quality of life outcomes, that sort of thing. So that to me is what success would look like, is that just as it is intuitive right now in community oncology practices, right, to ask patients if they're having any mental health distress, it would be intuitive to bring in the caregiver perspective in these conversations as well at the beginning.
I'll just add that the success of everyone is our success too, and we've been working very tirelessly in moving that needle forward with many of our tools that we have. And I think, I would just add that the conversation of caregivers is so important. And oftentimes when we just speak about patients, we don't put that into context. We don't put about the caregiver perspective. And so when we're talking about these data repositories, I would love to see a data registry, and maybe there exists, and I'm not aware of it, but just about caregiver perspective, because there's definitely ways to improve these value models or anything downstream when we have that accurate data. And also, Jason, we know that data lags. So when we're talking about national representation, we have data that is 3 years old, 5 years old, right? So there's really not a real-time process of capturing that information. So if we have a magic wand to say, I just want to know already what happened in 2024, I could have it right now, right? But, that's always just a process in the making.
That's right. Ushma.
Yeah, thank you. I think success for me would be if patients and caregivers are invited to the table, every table, and given a voice to co-create in research. I think we need to do a better job of building trust with communities and fostering relationships so that we are hearing from everyone, all populations. And then finally, measuring what matters to patients and caregivers, asking them. And this includes measuring not only the financial impact, but also those unseen or invisible impacts to patients and caregivers.
I love that. And I'll just end, I love that table metaphor. And I kind of extend that and say, there's restaurants who won't seat you until your full party is there. I think that's what success looks like for me, right? When your full party is inclusive of the family caregiver. Because I think when that expectation is there, that the family caregiver will be engaged and valued, then the tools will come, right? Then these gaps start to get filled because there's an urgency and an expectation. So thank you, Deneen, Ushma, Brett, Omar, for your conversation today, your insights, and also everything that you're doing independently through organizations to turn a lot of these, ideas into a reality to build that future where family caregivers are more recognized and integrated into value-based conversations, whether those are assessments, decision-making, beyond. It's going to take a lot of multidimensional challenge. It's going to take all sectors working together, and these kinds of conversations are critical. So thank you so much. Thank you to National Health Council for your partnership in this. Thank you to Genentech for your support, and to everyone who stuck with us for this conversation. Look forward to many more, and be well and Happy New Year.
Thank you.
Thank you.